Each year, nearly 5,000 babies are born at the birthing center at Lyndon B. Johnson General Hospital. It's one of the busiest and most experienced centers in the country. As you get closer to your delivery, LBJ will become an important part of your medical home. Your personal physician will still be overseeing your care, but we will be bringing in some specialists to help you through labor and delivery.
My name is Anna Jaco, breastfeeding educator.
These doctors and nurses will already be familiar with your personal medical history, thanks to our electronic medical record system.
How's the girl born?
When it's time for your baby to be born, your delivery team will be there and ready 24 hours a day. If you have any problems or questions, call OB Intake at 713-566-5742 or Labor and Delivery at 713-566-5503.
We're one team, we're kind of partners, if you will. And we have access to your medical record at any time. If you call us with a problem, we can bring up your medical record and see what your prenatal care has been. So when you come here, you're not a stranger to us. We may not have met physically, but we're aware of your medical history. We're aware of any problems that you've had in the pregnancy. So we can tend to your needs immediately. We don't need to spend a great deal of time reviewing your past history.
Dr. Sebastian Faro is the Chief of OBGYN Services at LBJ. He's also a professor at the University of Texas Medical School in Houston and Vice Chair of the Department of Obstetrics and Gynecology. He's one of the nearly 1,000 UT physicians who practice in our hospitals and clinics.
The doctors that work at LBJ Hospital are all affiliated with the University of Texas Health System. So you're going to get the same kind of care you would at the medical center down on Fannin. There's no difference. We have the same doctors working in both areas. These doctors will provide all the care you need. If you need any subspecialty care, it's here 24 hours a day, 7 days a week.
The birthing center here at LBJ was designed with you and your family in mind. We try to make it as much like home as possible so you have a comforting birth experience. For healthy women with normal pregnancy, we also offer professional midwife services. Our UT-trained nurse midwives have their own special way of caring for mothers through labor and delivery. When it's time for your baby to be born, you'll have your own spacious private suite where you will stay throughout your labor and delivery and also recovery. These comfortable, home-like suites feature private bathrooms, flat-screen televisions, and are large enough that you can include your family and friends in the special moment. You choose your own menu while you're here, and there are no set hours for meals. They're delivered to your room whenever you order.
We're going to continue with the tour.
We try to make our rooms comfortable, and we want to make sure you're comfortable.
Hi Elsa, how are you doing? I'm Dr. Medina.
The two more common options are your IV medications or your epidural, and I will talk to you about both. The one that we recommend the most is the epidural. It just gives you a superior anesthetic during your labor and for you and for your baby. I will also talk to you about the IV anesthesia, which is very reasonable, and it's up to you which one you would go with. The third option is to not have anything at all, and that's also an option for you. You let us know which one you prefer. When it comes to delivering babies, LBJ has some of the most experienced staff in the country. In fact, if you have a high-risk pregnancy, there's probably no better place to be. Our doctors from the University of Texas are considered to be among the best trained in the nation when it comes to managing high-risk pregnancy, delivery, and infant care. Dr. Sofia Zakiri is Assistant Professor of Pediatrics at UT, specializing in neonatology, the care of newborns. She's Medical Director of the Newborn Intensive Care Unit at LBJ.
We have specialized neonatologists that are caring for the babies 24/7, and we care from them from the time of their delivery all the way to their discharge home. We also have access to all the specialties that they may need, including pediatric cardiologists, neurologists, infectious disease doctors, special gastroenterologists. We have specialized people that are here all the time in the hospital.
This is the Level 3 Neonatal Intensive Care Unit.
It has the specialized staff and latest technology to take care of very sick or very premature babies who require intensive, round-the-clock observation and treatment. There's also a level 2 special care nursery for babies that might have a minor complication or just require a little bit of special attention. Healthy babies stay in the room with mom or in our level 1 nursery. While here, your baby will have his hearing and vision checked, so you'll know everything is all right before you go home. And that's often within 48 hours after delivery. Before you leave, we'll update your personal physician back at your community health center about your labor and delivery, and even set up your baby's first appointment with a pediatrician. We will be sure to keep you up to date on any immunizations or screenings we need to schedule. Now, we're your baby's medical home too. All of us working together as a family to stay healthy. We hope you take the opportunity to visit the LBJ Birthing Center and see for yourself. We have tours scheduled every week. Hope to see you soon. By the way, some of the things we've been talking about are discussed in more detail at the end of this program. Just select the topic you'd like to learn more about.